Good evening, guys. Welcome to our video today again. It's an evening here in Africa. It's around 6 p.m. here in Africa. I want to welcome you to our video today. Today we have, I told you this year we'll have more of these kind of videos here, and also enjoy what is we are supposed to enjoy. From the feedback I get from you, thank you for the great feedback I'm getting from you. You are enjoying the videos, and also I want you to keep enjoying them, and also for any clarification, for any improvement which we need to do for our video. We want to improve our background and also the voice quality for these videos. Kindly let us keep sharing so that we improve these videos with the better quality, and also the ones which can make us also enjoy whatever we are enjoying in this in our videos. So today I want us to talk something medical today, and we're going to talk about drugs. Drugs are a very important component in our health, and also yes, we can get better through other means like taking a lot of fluids, that's taking a lot of water, taking a lot of fruits to protect our immunity, also having good nutritional value from what we eat, eating the foods rich in especially the vitamin C. It boosts our immunity, and also we have special proteins also which build our body so that we get good health through what we are feeding on. But today specifically, I want us to talk about what we call beta blockers, or beta blockers, that is BETA blockers. That's a special class of drugs. From my previous video, I shared about certain class of drugs. Kindly, if you have not watched about on that class of drugs, you can go and look at the video so that you get to know what we shared about the other class of drugs. So we have different kind of classes of drugs which act in the body, and they act differently. But today I'm going to give a simple kind of discussion and also presentation of beta blockers. From the basic, I'm going to use the basic language so that we don't become so technical, because as much as these drugs we make use of these drugs, it is not all people understand that kind of language which can be used. There's a lot of biochemistry which is used in those drugs, how the drugs work in our bodies, and also how what time they take to get out of our body, and also why we need to take, like if you are told to take a dose of twice a day with your doctor, why is that? What is the reason? We call it in medical terms rationale of getting why should I take that drug twice a day. So there are the explanations, because those drugs, I told you, they are chemicals, and there's biochemistry on the same, which explains why a certain drug should be used in a certain way. So guys, welcome to our video, and also I want you to enjoy it. And kindly, this is Future Talks channel. If you have not subscribed, please subscribe. I want you to give the best quality, the best videos this year for you. And also we want our channel to go to we want those numbers in our channel. Please share with your friends, share with with other people, and especially those who are watching us without subscribing. Kindly, I want you to subscribe, because that's the best way you can support us, through subscribing. We are in the road to 10,000 subscribers, and we want to reach guys there before even the April of this year. We want to be in 10,000 subscribers, and I promise you more videos are coming, and best videos are coming. I want to get you the best videos, and also get to learn from those videos a lot of stuffs according to what you want. This channel is not for me, it's for you. So beta blockers are special kind of drugs Normally here in Africa we use them for treatment of what you call even angina. It is used for heart failure. It is used for other, especially in hypertensive patients, especially the patients with the heart failure. Heart failure means that they have a problem with the pumping action of the blood, because the heart has special muscles which normally pump our blood. But because of the pumping action, which it takes a lot of time, because heart is one of the organs which never stops as we age or as we grow old. So as we grow old, those muscles becomes weak. So somehow, because of the constriction and also because of the opening and closing of those valves in the heart, so we get to a problem. So we develop something called heart failure. Sometimes it's very serious, where somebody gets to get the valves of the heart or special pipes to the heart being replaced. Nowadays, the heart surgeries are done here in Kenya, especially in a hospital here in Nairobi called Karen. They do such kind of surgeries. They have done it for some time. But in recent past, we had a lot of patients going to India to manage those heart problems in India, because I know India is more advanced in medicine, especially for those surgeries. But here in Africa, we have now more hospitals coming up. We have like the Kenyatta University Hospital, which is a referral and also one of the best hospitals now in Kenya. They have what you call a card lab, where they do such advanced kind of surgeries for the patients. But as medical people, we always want to make people not to go to the extent of surgery. Before surgery, we want them to get well, because some of these conditions are really manageable at a certain level. And when we want to focus on prevention more than treatment. But when we get into treatment, but when somebody started on the beta blockers, which work on the heart, and also there's a way they work on the lungs. There's also the way they work on the kidneys to control the pressures in the body, or to prevent other problems for the body. So we get that those drugs really help us, or help a patient to get to a better level, where somebody can do the normal processes, or the normal conditions, or the normal processes in the life. Because having a condition is not a death sentence. I know the people watching this video who have heart problems, who have heart failure, who have angina, the one I've told you. Angina means painful, when you get a lot of pain in your heart area, like you have a lot of pain which radiates to the shoulders and also to the back. Sometimes the pain is very severe, where somebody cannot even accommodate it, originating from the heart problems. So such drugs are there to make our life comfortable for those who have this condition. The thing is, we as the patients, or the people who are on these drugs, or the people giving those patients those kind of drugs, should be very careful, because sometimes these drugs can really affect those patients in one way or another, as we're going to see. So normally our body has what you call a sympathetic nervous system. Sympathetic nervous system, in most of the time, it is within the heart, the kidneys, and also the lungs. So normally we have what you call in our body epinephrine, or we have what you call norepinephrine. Those are the beta receptors in the body. Beta receptors, normally they work from the time of formation of the heart, that is in the early stages where the baby is formed. These are very great receptors which work on in our body to make our heart and also our heart work well. So the work of the epinephrine and also the norepinephrine, which are beta receptors, is to make our heart pump, or our heart rate. Our heart rate means that how many times your heart beats in a minute. That's what we call heart rate. So the norepinephrine or the epinephrine works in the sympathetic nervous system of the body to make our hearts and also our pressure to be elevated. Because when you are running, like when you are running, you expect your heart pumping action to instead it was doing two, it will go two. So if you are doing 60 beats per minute when you are seated, when you are running, normally it is expected that your heart increases to 80 or 100 per minute. That is a normal way which the body works. So that is the sympathetic nervous system working in the body normally to increase the pressure to that level. So what beta blockers do, they regulate our pressures so that they don't increase or our heart rates don't increase, because sometimes because of the heart problems, those heart rate and the pressures go very high even when we are at rest. So because the body can't bring the pressure down alone or on its own, so that's why these drugs are introduced, the beta blockers. So they block the epinephrine and also the norepinephrine so that it doesn't increase our heart rate and the blood pressure. So it brings it to the normal level, whether we are doing any other activity to the normal level. And also the epinephrine and the norepinephrine, it works to strengthen the heart constructions. There is a way the heart should pump the blood. We are told our heart is like the size of our fist. You can see my fist there. That is, if you take a fist of your hand like this, that is the size of that's the size of your heart. So there is a way. There is a way and the strength which the heart should have, because the heart is full of muscles which really do a lot of activity and also pump the blood, especially when we are asleep and also when we are awake and when we are doing some other activities. So the norepinephrine and also the epinephrine works in the contraction of the heart. As they increase the heart rate and also the blood pressure, they also work on the strength of the contraction of the muscles of the heart, or what you call the cardiac muscles. The norepinephrine and also the epinephrine, they work on the lungs also, on the opening when we take in the air, and on the getting out the air. We get in the air, we get the oxygen and also get the carbon dioxide out. So they work on the smooth muscles of the lungs also, so that we have the opening and also the closing of the special muscles which we have in the lungs. That's what we call bronchodilation. Also, these two receptors, that is norepinephrine and epinephrine, they work on our kidneys, so that they can regulate the blood glucose. We have other things in the kidneys called angiotensin. Angiotensin, through the special hormone called renin, it is converted to angiotensin 2 so that they can regulate the blood glucose in the body. So somehow our hearts and also the way sympathetic system works, it regulates the blood glucose or the sugars in the body so that we get to normal levels. So when we get a disturbance in that, so we get that the sympathetic, with the use of beta blockers and also the normal regulation of the sugars through the kidneys, through the renin and also the angiotensin 2. So we get that there's a way the body changes the way it functions. So these drugs called beta blockers, like they are called blockers, they block this sympathetic system such that it will maintain the normal way. They try to maintain the normal functioning of the body, though it brings out some other effects at the same time. So the special cells is called cardiac myocytes. They help our body. So they through the epinephrine and the norepinephrine, they work in the body so that we get to function in what is expected in us. So example, we have those we have we have the classes of those drugs, like we have the what we call selective and non-selective kind of those drugs. The first one, the selective, an example of selective blockers, we have the example of atenolol. Atenolol is a very common drugs used. These selective drugs, they mainly work on the heart, and also they work on the kidneys. So they stop those kind of if it is broncho, if it is sugars, they affect the way glucose is controlled in the body. They also affect the pressure and also the heart rate, and also they have affect uh, how the heart, especially the heart functions, and also the kidney functions are affected. On the non-selective blockers, they work on especially mainly they work on the lungs. Yeah, that's they affect the bronchodilation, that's opening and also the closing of those special muscles in in the airway, and also especially the bronchioles. Bronchioles are small, they are very small in the lungs there, so they affect how those bronchioles work, because lungs mainly work on the gaseous exchange, that is air, the clean air getting to our body, and also getting the other the waste air out, so that we get also our body gets oxygen, which is gotten into the blood and also get to the circulatory system or the blood system, which does a lot of things in our body. So when we give these beta blockers, there are things which we should observe in our patients, especially if a patient tells you what is normally expected from those drugs, because now the sympathetic system of the body is not working very well, because the norepinephrine and also epinephrine, they are really affected in the way they function, or they are stopped to work the way they are supposed to work. So we have what you call blood cardia. That is, we expect the pressures to go very low. That's why, as a medical person, or as a person, or as a patient, you are supposed to know that when you take those beta blockers, that is like atenolol, it's likely to make your pressures go down. So sometimes, because of the way those drugs work on the the construction of the heart also, if somebody had heart issues, we are likely to get that the person gets into heart failure. Sometimes those drugs can cause heart failure, and this one you can know through if a person gains weight continuously, like in a week you started those drugs, and you get that a person was maybe 65 kg, the person is now getting to 75 kg. That's a sign that that person is accumulating a lot of fluids, or the body clearance is not very well. So that person may be present with swelling, or you may present with swelling, especially of the extremities. Like you can find that you have a lot of swelling on the ends of your body, like in the hands here, and also to the feet down there, and also gaining that a lot of weight. Also medical people, if you find that kind of a patient who is on hypertensive kind of treatment, especially the atenolol and the propranolol, the selective and the non-selective drugs, kindly, that is one thing which one should be, you should be very much aware, and also take care of that patient very well. Another thing, a patient may be, especially those on propranolol, may develop asthma like complications, like the breathing problems may come up, because of also of they affect the way the smooth muscles of the lungs work, especially on the bronchioles of the lungs. So we expect that kind of things. So monitoring the blood pressure is one of the things, because we expect, but sometimes blood pressure may go down very fast. So we don't want to get the person or the patient in normal pressures as much as possible. So maybe we titrate the dosage to get so that we don't get a patient into bradycardia, which can really bring all the low pressures, which can bring a problem. Also, we don't want heart failure, so these are drugs which, when a patient is put on, should be really be monitored and also titrated well, so that the patient doesn't get into heart failure. Monitor the weights of the patients and also check for edema of on the patients. Another thing, like asthma, also especially on non-selective, as I have said, especially the propranolol, they affect how our lungs also function. This patient may develop some signs like asthmatic kind of. The patient did not have asthma, but now the patient suddenly develops asthma-like symptoms. So that's one of the things which we should be very careful about. Also, as I said, because these drugs affect the kidneys work in a way that they regulate the sugars in our body. So because, as I said, we have what we call angiotensin 2, which is produced through a special hormone called renin at the kidney site of it. So when these are that kind of system in the sympathetic nervous system is the one which regulates our sugars in the body. Like when I eat, after some time, if the food is digested, then the glucose goes very high in the body. So through a special mechanism, through the kidneys, through the angiotensin 2, through the renin hormone in the system, it regulates the sugars through as it is produced to the system, so that to regulate and also lower the blood glucose level to the normal level. But since we are giving beta blockers, so that kind of thing is really disturbed. One of the signs of those people with high sugars or they are diabetic, when how they know what they are taught in the clinic about how do you to know when they are going to low sugars. One of the signs they are told is their heart to go high, or they have high heart rate. But because they are on those medications, and we say those medications normally they lower the blood the heart rate, that causing some blood cardia. So this patient may go hypoglycemic, or the sugars may go down in the body, and the patient cannot know. So those are one of the signs, because those patients who are hypertensive, or they have heart problems and they are put on these beta blockers, these drugs may cover those signs of low sugars in the patient, because the sympathetic nervous system is not working very well, and we may lose such kind of a patient. So the thing is, the patient should be taught on how to take care of those sugars, and also be taught on these drugs, because they may not see those signs of like reduced heart rate, because of the effect of those drugs. Also, the patient may develop low blood pressures, what we call hypertension. So those patients on those drugs should be monitoring their pressures very well, and they should be on the proper checkup, so that we don't go to hypertension. Hypertension can cause other problems in the body, which can cause other problems. So, and there's something which is very special about those drugs. When a patient is put on those drugs and has developed some problems with the drugs, the patient should not stop those drugs immediately, because we said those drugs counter the effect of the sympathetic system through the norepinephrine and also epinephrine. So we are likely to get a patient if a patient stops those drugs immediately, we are going to have the effect of the sympathetic system now taking the place, and the patient's pressures and also the functioning of the heart, the lungs, and also the kidneys may be affected. So we may have a lot of problems. So what we say about those patients who are on these drugs, is what we call tapering off. Like the dosage of those drugs should be reduced, uh, 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 which should be reduced systematically, not withdrawn drastically, because they may have a very great effect on the patients. so which may cause a lot of problems to such kind of patients. So drugs are good, yes, we take them. Beta blockers are good and they really help the patients, especially the patients with heart failure and also angina and other complications related to heart, and also the kidneys and other organs. But we need to be very careful, and those patients should really be monitored. Make sure you monitor your pressures very well if you are on hypertensive drugs, especially these beta blockers. The selective, we say they affect the selective, especially the atenolol. They affect the heart and the functioning of the kidney. And also we have the selective, which work on the non-selective, which work also on the lungs part of it. So we need to be very careful about them, so that we take care of those patients, and also as patients we take care of ourselves, because you only have one heart, and that we should take care of it. You only have two lungs, we need to take care of it. You have two kidneys, but we also have people who have one kidney at the same time. So we must take care of those organs, because those are the organs we call vital. In medical terms, we call those organs vital, because these are organs also functioning when we are even asleep. Those are the organs which are very important. The heart doesn't stop, especially the heart doesn't stop since you were born. It will only stop when you are dead, at least. That's when it stops. So even if you live like 1 year, your heart lives with you up to 1 year. If you lived 120 years, your heart lives with you with those 120 years. So as much we want to take care of those, we want to take care of our hearts and also organs. So on prevention part of it, we want to take care of our heart, especially our vital organs, through like I said, uh, a good diet. Yeah, we will have some program over the same. We will share something on nutrition. What is good nutrition? Because we have a lot of people telling us about good nutrition. Somebody says if you take some more drugs, they will take care of your cholesterol in the body and also your body. Especially people are very sensitive about body gain and losing weight and also gaining weight. So we will have a topic over the same and also share on what should be done over the same. But all the same, let us exercise, physical exercise. Physical exercise means, despite the age, yeah, it doesn't matter the age you are, that you walk, brisk walk till you sweat, like for around 30 minutes. That is a good exercise for your heart and also for your organ, or for your other organs. And also diet, for those of us who take like alcohol, is not very good for your heart, because at the end of the day it brings other problems. For those people who smoke, you are likely to develop heart problems and also lung problems and other multi problems. For those people who don't exercise, also you would gain a lot of weight. The body cholesterol will be affected, and other things will be a big problem. So let us balance our lives and also take care of the same. And also, when you are on these drugs of these beta blockers, you need to be very careful about your health. Go for checkup, and we recommend that you have even a pressure machine, so that you can be checking your pressures as you take those drugs, because we have seen how they affect our vital organs, and also how we can manage ourselves in such kind of situations, especially those patients who are diabetic. Also, we've seen these drugs also affect the way we also affect our sugars in the body. So you also need to be very careful and also monitor your sugars appropriately. Follow your doctor's guidance, also your medic's guidance on drug compliance, so that it becomes a good thing for you. And kindly, for those who are on treatment, especially the hypertensive and most of the time chronic illnesses, Don't just stop your medication because you feel your body is okay, or if I checked my pressure today and say my pressure is okay, so I need to stop the drugs. We found that the effect can be very detrimental, and you may die suddenly because of the malfunctioning of the heart and also the vital organs, and we don't want you to get into that kind of a situation. So kindly, if you have a query and you really feel that you want to reduce on the taking of those drugs, ask your doctor or your physician or your nurse who can guide you, who has knowledge on how those drugs should be taken. Don't just stop them, because if you stop them, you will get your organ problems and also your body into problems more than the good of the drugs would now be not of any essence to you if you've taken drugs and you suddenly stop them. Let your doctor guide you on how to stop them. We do what we call taping off, that is reducing the dosages till your body adopts to the normal way of sympathetic nervous system working as it's supposed to work. So guys, welcome to our video, and also for those of us who have not subscribed, kindly subscribe Future Talks, and also I promise you more good videos are coming. And also let me know from the feedback on what you want us to share about. And also I promise you the best is coming. And also I want to wish you all the best. For those who are in the day, want to wish you a good day, and those who are for the evening, want to wish you a good evening. We love you. Let us meet in our next video. Thank you very much, guys.